Margaret, Ciara Conway. I'd like to thank the Minister. I'm delighted that she's here in the House to listen to this issue, and one that I've spoken on before. And I suppose I felt compelled to bring it to the Dáil today because of the latest very worrying report that we've seen issued by the HSE, and it makes very worrying reading. It shows that almost 250 under-18s were waiting more than 12 months for mental health services at the end of just last year. The report shows that the referrals to the child and adolescent mental health services were up by more than 10% on the same time. So we also see that there's an increased demand for this service. The targets that were put in place for the child and adolescent mental health teams show that 70% of people referred would be seen within the 3-month period, which I think is a very welcome target. But unfortunately, they're just not being reached. It's not being met. The report shows that these targets in December, to some extent, did start to improve. But it just simply isn't good enough. And I've raised it here before that we have a cohort of people, very vulnerable young people in the country between the age of 16 and 18 who fall out of services. They neither fall within child and adolescent services, or equally they're misplaced in adult services, and oftentimes you will find children being detained in adult psychiatric hospitals, and something that I hope, Minister, that over the lifetime of this government that we will see and categorically bring that practice to an end. A year, I don't have to tell you, is a very long time in a child's life, and children are being left to cope with difficulties that can hold them back in their normal development. It impacts significantly on their education and their childhood and their future well-being, because if they are not to receive the service that they so badly need at this integral window in time of need, it can have huge repercussions for their further development. In 2012, in 2011, I should say, Bernardo's prepared a children's budget and pinpoint that community mental health services were very slow to recruit their staff. And I just wonder if there's any update in relation to why that is. As a result, in 2010, we saw the child and adolescent mental health services teams had only 41% of the recommended staffing level. That's less than half of what is recommended. That's quite shocking. As of November 2011, there were 61 teams nationwide with inadequate resourcing for these services, and the lack of the interagency working that we know that works and we want to push forward between the services and children and child welfare services, protection from the juvenile justice system continues to mean that very vulnerable young people slip through the cracks, and many opportunities for intervention are missed, because both you and I know, Minister, that the earlier that we can intervene with young people, the better the outcome and the better life chance for that child. For children living in poverty in Ireland, access to healthcare services is hindered due to the lengthy delays and insufficient resources. Many children wait up for a year for crucial services such as speech and language therapists, developmental checks. Child and adolescent mental health services is now up there with that list, I'm sad to say. My former colleagues in Bernardo's have highlighted circumstances where children presenting with suicidal thoughts were put on waiting lists for up to 2 years. For an appointment with the member of the CAMS local mental health team. 2 days or 2 weeks, Minister, I think you'll agree, can be an eternity for somebody who's in this situation, and especially true for children and young people. We need to see a significant improvement in this area. This is especially true when we consider, with your indulgence, that the suicide rate in Ireland between the age of 15 and 24 is the 4th highest in Europe, and I think we all need to be very cognizant of that. Margaret.
Minister.
Could I just, and I have a script, Ciara Conway, but I met recently Brendan Doody, who's the man that's in charge of CAMS in Ireland, and I was hugely impressed by him. And I would have to tell you that, you know, I have no reason to doubt what he's telling me. No reason to doubt what he's telling me. And he gathers information in a way in relation to mental health that no one else does, Ciara Conway. No one else does. Despite the fact that our child and adolescent service is very new and very young, he has information on that service which we come nowhere near having in relation to adult mental health, despite the fact that our adult mental health service has been there since God was a boy, and we all know that. So I have no reason to doubt what this man tells me. And this man gets this information every single month. He tells me that he can pull out information. If we only had it in other areas, if we had it in disability, if we had it in travellers, if we had it in all those things, we'd have an incredible service and we'd know where to direct money. And I think probably down through the ages that has been our difficulty in terms of delivery of service. But I have no reason to doubt what he says. And I would like to thank Deputy Conway for raising this issue, because she has had an interest in it and continues to have it, and it's an area that needs focus. Against the backdrop of reducing resources and increased demand for service, reflected in an increase in child and adolescent psychiatric referrals of almost 10%, as the Deputy says, the HSE has succeeded in reducing the child and adolescent waiting list by over 21% in 2011. This clearly highlights the fact that in mental health we are changing the challenges presented, and we can and will continue to make improvements and do more with less. Key to the development of child and adolescent mental health services is the establishment of multidisciplinary teams, of which, as the Deputy has already pointed out, 61 are currently in place. In that regard, I was pleased to announce a special allocation from the 35 million for mental health as part of Budget 2012, in line with the Programme for Government Commitments. Funding from this special allocation will be used primarily to strengthen community mental health teams in both adult and children's mental health services, by ensuring at a minimum at least one of each mental health professional disciplines is represented on each team. Approximately 400 additional staff will be recruited to support these initiatives. The Deputy has drawn attention to 241 children who have been waiting for 12 months for an appointment at the end of 2011. While I note it is a reduction of almost 29% on the number waiting at the end of 2010, and I would like to assure you that all referrals received by the Child and Adolescent Mental Health Service are screened, and those deemed urgent are seen as a priority, while those deemed to be routine are placed on a waiting list. And of course I am anxious that children are seen as quickly as possible, and for this reason the National Service Plan 2012 includes a target that 70% of all new and referred cases will be offered a first appointment and seen within 3 months, and that no child will wait longer than 12 months for an appointment. I am confident that the additional resources provided to the Child and Adolescent Service from the special allocation of 35 million will reach these targets. In conclusion, let me say that as Minister for State with responsibility for mental health, I am committed to ensuring that the implementation of a vision for change in this context, and I am particularly keen to advance service provision for young people. The data shows that the HSE have made considerable progress in the delivery of child and adolescent mental health services since 2011, and we will do all we can to ensure that this momentum is maintained in the current year.
Thank you, Minister. Deputy Conway.
Gormagat. I'd like to thank the Minister for her response. And what I would like to say as well, Minister, is that I think what we need here is to see joint up thinking in terms of trying to tackle this problem, because it's not something that rests solely at your door. I think we need to see greater integration of services from the Department of Health, from the Department and with the Department of Children and the Department of Education to meet the psychological and emotional needs of our children, and particularly that most vulnerable group in the 16 to 18-year-old bracket. I welcome the advances that have been made in relation to tackling the waiting times for young people with mental health difficulties, and again to congratulate you in the very harsh economic times that we find ourselves in being able to secure 35 million for the progression and the further investment into what is a vital component of our health system, that being the mental health services. So I thank you for your response and look forward to working with you into the future to further advance the needs of some of our most vulnerable people.
Deputy, I'll be very brief, Ciara Conway. I think that one of the most startling things that we've managed to do is in fact to ring-fence that money. But the money in itself would have been useless if we didn't manage to get the 414 posts as well. I think that's what's going to be important. The other thing is that the increase in the bed capacity in relation to child and adolescent, and we are very much about to reach our target this year with the opening of 8 new beds in Cork, Galway, Dublin, and the decrease of 40% of admissions of children to the adult psychiatric services. Above all else, if a child finds themselves in difficulty, I think the compound distress of having your child admitted to an adult psychiatric unit must be unbearable. And we will do it. And every single multidisciplinary team will have now one of each profession. That is going to be crucially important, because up to this point I kept hearing we have 126 multidisciplinary teams, 61 multidisciplinary teams in relation to child and adolescents. But when you dig deep and you say, what does that team consist of? What we then find is that in some cases it would be a psychiatrist and a psychiatric nurse and things like that. Having one of each profession in that multidisciplinary team will have to have the type of effect that we all want. And I would thank the Deputy.
Thank you.